2 years after getting over with the COVID-19 pandemic, should we be preparing for another global pandemic? This time the virus in focus is the Mpox virus, which was initially endemic in Africa, but now positive case has been seen in Europe, in Sweden, and one positive case has been confirmed in Pakistan with 2 more suspected cases. Therefore, this new variant of Mpox, which is spreading widely, is of great concern. And on 14th August 2024, the WHO has declared Mpox as a public health emergency of international concern. Previously, it had declared the same on 22nd of July 2022, when a global outbreak occurred and Mpox cases were reported in Africa, America, and Europe. Since then, the cases have continued, and now from the beginning of this year, the cases have increased rapidly with a new variant responsible for it. This time, the variant is a mutation of clade 1, and it is known as the clade 1b virus, Mpox. So this is the one which is spreading more rapidly, and just in this year we have had around 15,600 cases in more than 13 African countries. It has jumped borders to the neighboring countries from the Democratic Republic of Congo, and it has crossed over to Rwanda, Uganda, Kenya, Burundi, and now is traveling globally to Europe and Asia. And overall, up till now, from 2022, 116 countries have reported cases with more than 100,000 cases and 537 deaths up till now. And just in this year, the number of deaths is 112 due to this new virulent virus. And this time, it is mostly the children and the young adults who are being affected. So what is Mpox? Where has it come from and how to deal with it? I'm Dr. Mariam Atiq. Let's talk about this. Now, this Mpox is a double-stranded DNA virus belonging to the orthopox virus genus. And it is very closely related to the variola virus, that is the smallpox virus, which was already eradicated from the world in 1980. But Mpox is there. The very first case was reported in 1958 in Denmark amongst the monkeys which had been kept for research. That is, it is a zoonotic virus beginning in the animals. We do not know from before that where did it actually originate from. Since then, it transferred over to the humans, and in 1970 in the Democratic Republic of Congo, the first human case was seen, and this was amongst the homosexual population. Since then, the cases, as we just talked about, are continuing. So, what do we do? How do we recognize it? How can we prevent its spread? And how can we treat it are the main things that we are concerned about today. Now, it spreads by direct contact. That is, from the infected person to another infected person, by touching, by kissing, by having physical relationship, by having homosexual relationships, or even when you are handling the infected people, you can get the virus. Then from animals to infected animals to humans, it can be transmitted while they are handling those animals. And then from the contaminated items, that is the bedding, the towels, the clothes that are being used by these infected persons, when they are handled by the others, it can get to them. Then the symptoms. The symptoms are, there is going to be a flu-like scenario in which there will be fever, headache, body aches, malaise, lethargy, lack of energy. And then there are going to be the skin symptoms, the skin lesions. Initially, there is a flat reddish rash all over the body. Then these change into rubbery nodules and they become the papules. Next, they fill up with fluid and they form the blisters, the pustules, which are depressed in the center. And then these start scabbing off, these start crusting. All this takes about 2 to 4 weeks of time. And along with these, there is going to be lymphadenopathy. The blisters are going to be painful, they are going to be itchy. So how to diagnose it? It is diagnosed by testing the fluid present in these vesicles, which can be taken from either the oropharyngeal area, the anal area, or the rectal area. And the PCR tests are done, which confirm the presence of the Mpox virus and which strain it belongs to. Normally, it has two subtypes, the clade 1 and the clade 2 type. Now, the new virulent is the clade 1b type, which is a mutation of clade 1. So, how do you treat it? The first thing is that we need to start wearing our masks again. We need, those of us who are handling these patients, we need to keep the personal protective gears again we need to start them in practice. We need to wear masks, we need to wear gloves, and we need to take care of our hygiene. The ones who are suffering with it, they have to stay isolated from the beginning of the symptoms till all the lesions, they heal off, they crust, and the crust has fallen off. Then they will have to be dealt for the pain management, for the fever, for management of the skin lesions, and complications have to be prevented in them. For that, the doctor is going to advise different kinds of supportive medicines, soothing ointments, etc. You have to get yourself checked by the doctor. Don't just stay at home thinking that it is simply the chickenpox virus, because they also give quite a similar presentation. Then the mouth sores, they can be taken care of by doing salt water gargles regularly. Then the body sores, you can have warm baths with baking soda, Epsom salts, or sitz baths for them. Hand washing regularly is very, very important, both by the patient and by those who are dealing with the patients. Along with that, sleep well, eat well, and stay hydrated so that you build up your immunity to fight against the disease. The part of the medicines is going to be dealt by the doctor. Take the medicines as advised. Now, the prevention. The prevention is by vaccinations. Two types of vaccinations are already available, and there are 2 doses which need to be administered. Then safe sexual practices should be adopted. There should be fewer sexual partners. Homosexuality should be abandoned altogether. Then again, cleanliness, keeping the areas clean, keeping yourself clean, keeping the shared places clean by disinfecting them. All this has to be done. And for the diagnosis, it is very important to have a good history, because usually there is a travel history of the person who is infected from that place where it is endemic. Like even the case in Sweden, that person who was diagnosed had a history of traveling to a place in Africa where it was endemic. In Pakistan also, it was by one of the travelers, either from the Saudi Arabia or some other countries who were diagnosed with it. Therefore, a travel history is very important. If somebody has traveled in, or if the person himself has traveled from an endemic area, it is of great importance and should be reported. Then how do you differentiate it from chickenpox? In chickenpox, there is going to be no lymphadenopathy, whereas in this, there is going to be lymphadenopathy. Then the chickenpox lesions, the skin lesions in chickenpox, they are of multiple developments at one time. Some of them are just red rashes, and some of them are blisters, some of them are scabbing at one time. Whereas in Mpox, these skin lesions, they are going to be of the similar type all over the body, and they are going to be quite pronounced on the hands and palms and feet, and rest also everywhere in the body, especially in the private areas too. So, taking care of yourself and your loved ones and your neighbors and your community is a must for everyone. So share the information, stay safe and stay healthy. Thank you, and inshallah we'll meet again with another topic. Assalamu alaikum.